The UN is warning of an exponential rise in the number of Ebola cases in West Africa. In Liberia, some Ebola treatment centres in the capital have already reached capacity, leaving many patients stranded. They've been brought in from various parts of the country. The virus has already killed more than 2,000 people in West Africa. The UN expects thousands more cases.
No space. So we're calling on the Liberian government to please open more centres, at least up to, we can get up to 10 to 12 centers or 15. I can tell you, my sister, this virus surely by God's power is going to go down.
The African Union has been meeting in Ethiopia to discuss a joint response to the Ebola outbreak. Health and foreign ministries say other African nations need to mobilize resources to help the affected countries. Catherine Soy reports now from Addis Ababa.
Close to 7 months after the Ebola epidemic began in West Africa, the African Union's Executive Council has held its first emergency session. Calls for a more coordinated response, funds and deploying medical teams dominated the agenda.
The UN estimates that need at $600 million immediately. WHO has a clear roadmap for the process. The minimum to expect is that Africa comes in solidarity for this emergency package to be implemented without any more hesitations. Time is pressing. That is the real solidarity.
Several countries have closed their borders to Sierra Leone, Liberia and Guinea, the most affected nations, some of the poorest and still recovering from decades of conflict.
For each African country, putting in place draconian measures that are not medically justified, they have to think of themselves being under the same measures in a not so distant future as a very likely possibility.
Analysts have criticized the AU for responding so late into the crisis and then not taking the lead in international coordination efforts, an accusation its chairperson says is unfair.
We've had outbreaks of Ebola in the DRC in particular and some neighboring countries, and they've never taken this magnitude. We've never had to call any emergency meeting. Clearly, everybody underestimated this.
At the end of the day, they resolved to be more coordinated, to also engage more with member countries in order to commit resources needed to contain the outbreak. Many of those who've been watching this emergency meeting hope that beyond the rhetoric, the AU will be able to step up and do more to make its presence felt in the countries that have been most affected by this devastating epidemic. Catherine Soy, Al Jazeera, Addis Ababa.